Diet for high blood pressure and their relation between your diet. If you have bad eating habits, then it contributes significantly to unhealthily high blood pressure levels, even in middle age, when blood pressure levels typically rise as part of the aging process. Whether or not you are taking medications to lower down your blood pressure, the need to make dietary improvements is frequently at the top of a doctor's list of recommendations to reduce or prevent the onset of high blood pressure. Before outlining the best type of diet for hypertension, let's take a brief look at health consequences of raised blood pressure. High blood pressure. In underdeveloped as well as developed countries, an estimated 20 to 40% of all adults suffer from persistent high blood pressure. High blood pressure puts a strain on the heart, causing atherosclerosis or thickening of vessels. Result is damage to heart, coronary artery disease, kidney failure, stroke, eye damage and many more. The choice is yours, and try to save these important organs by controlling your blood pressure. Remember, hypertension is a silent killer. It shows its effects silently, and when you come to know that you have hypertension, it might be too late. Normal blood pressure of an healthy adult at rest is 120 systolic over 80 diastolic or less. Blood pressure levels greater than 120 80ths and below 140 90ths are at prehypertensive stage, while levels above 140 90ths are considered hypertensive stage. Both prehypertensive and hypertensive subjects should make diet, exercise and lifestyle changes to reduce or prevent the onset of hypertension and reduce the risk of heart disease. Weight increases blood pressure. Overweight persons will be having high blood pressure. Weight reduction significantly decreases blood pressure. People with obesity double their risk of developing high blood pressure. In addition, roughly 7 out of 10 obese adults suffer from high blood pressure. If you lose even 10 pounds can produce noticeable improvements. Dietary advice and tips for high blood pressure. If you have high blood pressure and not overweight, here are a few tips to control your BP. Choose a healthy, balanced diet. If you want to reduce your blood pressure, your diet should be rich in fruits, vegetables, and low-fat dairy foods, while low in saturated and trans fats. It should also be low in cholesterol, high in fiber, calcium, potassium and magnesium, and moderately high in protein. Reduce your intake of salt. How salt intake increases blood pressure. Eating too much salt or sodium-rich foods leads to a greater uptake of fluid and causes greater water retention inside body, leads to volume overload and high blood pressure. It also places extra strain on the arterioles, the blood vessels that dilate, constrict to regulate blood pressure and blood flow. Both these effects lead to higher blood pressure. The recommended daily dose for sodium for most people is 2,400 milligrams. How can you decrease sodium intake? Eat less pre-cooked or processed food, and eat more fresh food. Sodium is found naturally in fresh foods like grains, fruits, vegetables, meats, nuts, and dairy products, but in much lower quantities than in processed foods like packet of crisps, bottled or canned food. High sodium foods. These foods typically have a high sodium content. In order not to exceed the recommended daily allowance, either avoid them altogether, or choose low sodium varieties. Sauces: baking soda, barbecue sauce, catsup, garlic salt, mustard, onion salt, soy sauce, steak sauce, salad dressing, baking powder, mustard, onion salt, seasoned salts like lemon pepper, bouillon cubes, meat tenderizer, and monosodium glutamate. Salted snacks: peanuts, pretzels, pork rinds, tortilla chips, corn chips. Soup: instant soups, regular canned soups. Pickled food: olives, or sauerkraut, herring, pickles, relish. Meats: smoked or cured meats containing sodium nitrite, such as bacon, bologna, hot dogs, ham, corned beef, luncheon meats, and sausages. Dairy: most cheese spreads and cheeses. Cereals: instant hot cereals, regular ready-to-eat cold cereals. Ready-to-eat, boxed mixes like rice, scalloped potatoes, macaroni and cheese, and some frozen dinners, pot pies and pizza. Quick cook rice, instant noodles. Fats: butter, fatback, and salt pork. Check labels of food containers. Choose those foods which labeled as low sodium, very low sodium, or salt-free. Check food labels for words that indicate a high sodium content, including sodium nitrite, sodium propionate, disodium phosphate, and sodium sulfate, monosodium glutamate (MSG), sodium benzoate, sodium hydroxide. Lower sodium eating habits. Do not add extra salt when cooking or preparing meals. Cook with more herbs and spices. Do not have salt on the table while eating. Do not add salt on salad. If you cook with salt, switch to chili, ginger and lemon juice for flavoring. If you eat cured, smoked meats, switch to fresh cold meats. If you eat ready-to-serve breakfast cereal, choose low-sodium types of cereal. Rinse before eating, if you eat tuna, salmon, sardines, or mackerel canned in water. If you eat soup, switch to low-sodium or fresh soups. If you cook with whole milk or fat diet, switch to 1% or skimmed buttermilk. Remember, taking less salt on your diet, your blood pressure will be in normal limits.